We are grateful for the opportunity to present our poster to you today, focused on findings obtained through our ITP Natural History Study Registry. Our study is titled Anxiety in Adult Patients with ITP Stratified Across Different Treatment Groups. Our disclosures. The goal of our study was to compare the impacts of anxiety on adult ITP patients to determine whether anxiety levels differ depending on the method of treatment. Adults in this study are defined as individuals over the age of 18 years in any phase of ITP. This was a prospective cohort study, and in this study, adult participants were separated into different groups. These groups were those who have never received treatment in the past at all for their ITP, those who have received medicinal treatment but not within the last 6 months, and those who are currently receiving treatment for their ITP or have been within the last 6 months. This last group was further subdivided into those receiving a first-line therapy, such as corticosteroids, anti-D, or IVIG treatment, versus those receiving a second-line therapy, such as rituximab, a TPO receptor agonist, or other less common second-line therapies, such as dapsone and complementary therapies. To provide you with an overview, we found most participants received treatment for their ITP at some point. 43% were currently receiving treatment or had within the last 6 months. Most participants who were receiving treatment for their ITP were receiving a monotherapy, and the most common therapies reported included corticosteroids and TPO receptor agonists. Interestingly, most participants were receiving a second-line therapy compared to a first-line. Separate from asking about medicinal therapies, using data from our Natural History ITP registry, we were able to show that 23% of adult participants had reported they had a splenectomy in the past. Within the Adult Quality of Life survey in the ITP registry, participants were asked to rate how often in the past 7 days they felt anxious and found it hard to focus on anything other than their anxiety. Response choices included never, rarely, sometimes, often, or always. We found that overall, there was a high number of participants who reported feeling anxious in the last 7 days, and 17% experienced anxiousness often or almost always. Over half of all participants reported in the last 7 days they found it difficult to focus due to anxiety, and almost 10% experienced this often or almost always. When stratified across treatment groups, similar trends were noted, including among those who had never been treated for their ITP. Anxiousness was highest among those reporting they were receiving a first-line therapy, although differences in anxiousness were not significant across treatment groups. We did identify a significant difference among the different treatment groups in terms of anxiety affecting focusing. Those currently receiving a first-line therapy reported the most difficulties focusing due to their anxiety related to their ITP. Overall, anxiety appears to be a frequent symptom and emotional burden among ITP patients. In summary, the most predominant first-line therapy used by participants was noted to be corticosteroids, and the most predominant second-line therapy was a TPO receptor agonist. Almost 2/3 of patients reported feeling anxious. More than half reported difficulties focusing due to their anxiety. However, these two measures of anxiety were experienced often or almost always in less than 20% of participants. Overall, high levels of anxiety affecting focus and concentration did differ by treatment group. In conclusion, while healthcare providers usually focus on preventing bleeding, they should also consider mitigating anxiety and other indicators of mental health when treating ITP patients. First-line therapy users were more impacted by anxiety compared to those receiving a second-line therapy. This might be because first-line therapy users were more likely to be taking a corticosteroid, and steroids are known to interfere with mood and concentration. High levels of anxiety could also be attributed to coping with the uncertainty of ITP, especially if newly diagnosed. We did not stratify by phases of ITP in this study. As a next step, that might be impactful. That concludes our poster presentation. Thank you for your attention.